to Bella Society with me, Sarah Ibrahim. What you just saw is very interesting because we're going to talk about that today. That lady going through a sort of normal day-to-day life, not knowing what she's actually experiencing. With me today, I've got two experts who are going to help us to pinpoint exactly what she went through, and hopefully it won't happen to you. With me, I have Datin Dr. Liu Yin Mei. You are from the Heart Foundation of Malaysia, Datin.
Yes,
and next to you, we have Dr. Abdullah Asad Siddiqui, an emergency physician. Welcome to the show. Today's kind of an unusual show because we're talking about lots of things, you know, prior to you arriving here, but it all relates back to this, which is health, because you can have your business, you can look good, you can, you know, just be prepared for everything in life, but sometimes some things take you off guard, such as a stroke, heart attack, etc. Can I just ask you, doctor, what you just saw in the video just now, what exactly was happening to that mother as she was busy and, you know, so erratic? What was it?
What was happening was that her blood supply to the heart was being compromised. But her heart was not stopping.
Right, because a lot of people think that if you have a heart attack, that your heart stops.
No.
And then you faint.
No.
And then, like in the movies.
That's sudden cardiac arrest.
Okay.
That's sudden cardiac arrest, which is an emergency. This is an emergency, but you still have some time, like she was still talking to her family.
Wow.
So her blood supply was being compromised in the heart muscle, that's heart attack. And if the same thing happens in your brain, that's a stroke.
So stroke is in the brain. When the blood is compromised to the heart, that is a heart attack. However, if you faint immediately, it is a sudden cardiac arrest. Now we know the differences, because a lot of people imagine it all to be the same thing. So then it's quite possible to have a stroke or a heart attack, but look kind of okay then, is it, doctor?
Yes.
So people out there, you know, they need to know what are the signs of it. As we just saw just now, the lady, her arm was hurting. Could you elaborate a little bit more on what the signs are, Datin, perhaps, you know, and explain, you know, to ladies out there what they need to be looking out for themselves and their family members?
Right. So when they have a heart attack, besides the symptoms which they feel as a patient, the signs which others can see. And they can just sometimes collapse, and then they have severe pains. Classically, it will be in the chest area, but this can radiate to various areas like the jaw, down the arm. As I believe in this lady, that's why she was clutching onto her arm. You know, she probably felt the pain there. And this is quite common, this sort of radiation. Can also go to the back. And in females especially, they can be quite atypical, in the sense that sometimes they do not get these classical symptoms, you know, but they can get this feeling of indigestion, you know, and nausea, giddiness like.
Do all the signs need to happen simultaneously, or is it like an individual thing that happens?
May not be simultaneously. It can be just one thing, maybe just be one symptom or, you know, one sign. You know, so that's why in females especially, we think that we do not have heart attack, but actually females are just as prone as men to get heart attack.
Now
and
that's
it's the number one killer. Yeah, it's the number one killer in women.
The number one killer in women is heart attack.
Yes, though normally it appears in an older age group compared to men.
Yes.
So after menopause, about the age of 55 onwards, they get heart attacks, whereas in men, they tend to occur younger.
Why is that? Is that because of hormones or just lifestyle generally, like men being more active and more physical? What is the difference?
I suppose it is a combination, because certainly the hormones have been shown to be protective, cardioprotective, but and lifestyle, well, those days, men used to be the breadwinners and they were working hard.
Yes.
I think nowadays it's a different story.
Women are also
Women, in fact, they work doubly hard, I would think, you know.
So you're saying stress then?
Oh yeah, stress,
is a
you know,
big cause.
they have multiple roles, you know, and the other thing with women is they tend to ignore these symptoms, not like, because when these symptoms occur in a woman, they tend to ignore it and they think it's something else. They could be just tiredness, you know, fatigue.
Yeah, I'm a bit worried about what you just mentioned just now, like a pain in your arm or back and then indigestion. And like a lot of women experience that. Like I've experienced those kind of things. How would I know, Dr. Abdullah, like if I've had a stroke or a heart attack? Is it possible to have it and then continue on your day and not notice?
If you're having a stroke, a very clear signs is you're going to have slurring in your speech.
Slurring in your speech, okay.
And then you might have weakness on either right or the left arm or the leg. And you might feel a bit dizzy.
Yeah, like the lady
right?
did in the
Yes.
video.
But more important than you people around you should be aware of the symptoms of stroke as well. Because if you are having a stroke, you need to get to the hospital within 4 hours, 4.5 hours.
Why are you putting that time frame there, doctor?
Because if you can get, like, let's say I'm getting a stroke right here at the moment, you have to get me to a center who can take care of a stroke within 4.5 hours so that they can give me a medication which can clear the clot that is stopping blood from going to my brain.
Yes.
But if it's more than that, then we cannot give that medication to me.
Okay, so just to re-clarify again, because a lot of people at home, including myself, don't understand this fully. So if it's a stroke, it's happening to your brain, therefore the damage could be brain damage.
Yes.
Can you also die from it?
Yes, you can die if it's a very massive stroke.
Okay.
Yes.
Secondly, you've got your heart attack. Your heart attack is like what we saw in the lady just now in the video.
Yeah.
You can act normal, but still, you know, you're actually having a heart attack. What can happen as a result of having a heart attack?
The worst is you can collapse.
Okay, and die?
And you can die. You can die. But that is if you don't get the help immediately.
Immediately, as in within?
Within 6 minutes.
6 minutes?
Yes. I remember when you were introducing this program, you said ambulance comes to somebody's help within 15 minutes.
Here in Malaysia, that's what
minutes,
research
right?
and stats
Yes.
have just shown.
And when your brain doesn't get the blood, for 6 minutes, it dies.
Wow.
There will be permanent damage. That is the reason where CPR comes in.
Now, that's where I wanted to lead into. CPR in its full length is?
Cardiopulmonary resuscitation.
This is where you're resuscitating someone who's just suffered from a heart attack,
cardiac arrest.
sudden cardiac arrest.
Yes.
What about someone who's just had a heart attack? Because you said it's different.
It's different. Somebody who is having a heart attack, like the lady in our video just now, she should be sent to the hospital within 90 minutes.
Right, okay.
Within 90 minutes, so that we can give some medication which is similar to the medication we give for stroke. But for heart, the timing is a smaller window.
So, Datin, Dr. Liu, you know, from your experience, you work in Malaysia, you are here. Are we well prepared as a nation to deal with stroke, sudden cardiac arrest, or heart attacks?
I think it depends where you are living in this country.
Okay.
Because not all areas are accessible to such medical facilities nearby in such a short while. You know, so again, whereas in the cities, we are not too badly off. There are quite a lot of hospitals around, you know, and clinics that you can seek early treatment.
Yes. Are there certain things, just before we go to break, Datin, that a person can do to prevent him or herself from having a stroke or cardiac arrest in their life?
Certainly.
Any tips there? Yeah,
certainly, because as you know, there are various risk factors that predispose a person to such strokes and heart attacks.
Yes.
And the risk factors can be actually classified into modifiable and non-modifiable risk factors. The non-modifiable ones would be something you cannot do, you know, like age. As we grow older, we're more prone, you know, family history. If you have a bad family history, you can't choose your parents, you know, genetics.
Are the chances of getting a stroke or heart attack more if someone
quite
genetically?
Similar. Yeah, of course, similar, because the tendency is there with high cholesterol and things like that, you know. Then
does smoking make a difference?
Then this would be the modifiable risk factors, what we can do. So all the smoking tops the list actually is a very important risk factor.
So stop smoking if you don't want to get a stroke or heart attack, basically.
Yes, besides other things, lung cancers and so on, besides. Yeah, then diabetes, you know, is also a very strong risk factor, makes them very prone. And hypertension, high blood pressure.
Hypertension and high blood pressure is linked to stress and lifestyle as well, though, isn't it?
Certainly, yes. Then
so
high cholesterol in our diet, you know, and obesity, you know, lack of exercise. And I think in women also, if they have a very poor lung function, if they're very low vital capacity, that's also a risk factor.
Which is not helped by smoking.
Right.
We have some footage. Basically, we've gone out and asked people on the street, because it also relates to what you said, Doctor, you know, what can be done quickly to assist somebody in a circumstance where either they're facing a stroke, a cardiac arrest, or a sudden cardiac arrest. And we asked them, you know, if they were to actually discover someone who just fell unconscious, say, for example, out there, what would they do? And this is what some people had to say.
I would definitely call 911 ambulance and see what I can do with that. And yeah, we'll ask around if anyone knows what happened to whoever. And the first thing I'm going to do is call the ambulance.
First, you help that person lah. help the person up, and then you call for help.
Okay, if I suddenly found someone drop on the floor, unconscious on the street, first thing I would do is, of course, I'm holding my handphone all the time. I will call the ambulance to inform that there's someone unconscious on the road. And at the same time, after doing that, I will just go to that person and just, try to see whether he's still moving, still breathing, and what I can do if he's still like, after that he's conscious, that I can be with him until the ambulance comes.
Definitely not hesitate to help that person, with my own guts, with my own ability and my own physical to help that person. Before that, I will make sure everything is fine. Then I will definitely make sure that person will be safe in my hand and call for any help.
Well, I will obviously shout and ask for help. And then secondly, we'll call the ambulance. I think that's what everybody would do.
Now that's just scary, because basically the response is I'm going to shout and ask for help, or I'm going to see if I'm capable. In the meantime, as you said, Doctor, you've got 4 minutes or 6 minutes to help somebody if they've had a stroke. What are we going to do as Malaysians? Nobody actually answered CPR, which is scary. So basic life support, no one actually said, I'm going to perform CPR, which is, why is that? What do you have to say about that?
That means that me and my emergency colleagues are not doing it very well.
Is it?
Yeah.
Why would you say that?
Because we're not doing a very well awareness program probably.
Well, this is the moment, we have this platform here on this show to talk about that, So what would you want people to be aware of?
I want anybody, like most of them said, they would go and help. That's the start. That's very good. At least they're going to go there. But if somebody collapses, so you have to go to the person.
Yes.
And then ask the person, are you okay?
Okay.
Tap on his shoulder, go down to his ears and ask him, shout, are you okay? And if you don't get any response, quickly ask for help. And the number to call is not 911. Okay. That's in America. Here we call 999.
999 is the number. If somebody you know falls unconscious, not 911, 999. A lot of people are calling 911.
Help might come, but after 1 week.
Help might come after 2 weeks when they come on the plane.
Yes.
999 is the number. So first ask the person, are you okay? No response, get 999.
Call for
help. If they say, I'm okay, like the lady in the video, like, hey, I'm okay, but they're not okay, so how?
Pick her up, run to the hospital.
Pick the person up and run to the hospital.
If she's talking to you.
But we would prefer to have the ambulance come and arrive and assist us. Do we need to have a specific, like training in CPR, doctor? What's lacking? Because I myself, I don't know how to.
We need to have more mass CPR programs where we can invite people to come and learn, because it takes about 2 to 3 hours for you to master how to do CPR.
You have a program in your hospital that will help people,
yes,
right?
We do.
Datin, have you ever had to do CPR for anyone?
Oh, yes, when I was working in the hospital, this is within the hospital premises.
Oh, wow.
When I was in the CCU, the coronary care unit, it happens quite often.
And did you help somebody come back to life from doing it?
Occasionally, I would say it's not 100% successful, but in a hospital setting, we do have a better chance because there's more equipment around and there are more medicines around.
Yes, but at home, the main point here is at home, at work, at school, if we all learn how to do basic life support, basic CPR, at least the chances of helping somebody who's fallen unconscious increases. And speaking of that, when we come back after the break, we're going to learn some basic CPR with both the doctor and also Datin here, as much as we can with the time we have. You never know, you might need it at home yourself, so stay tuned. You're watching Bella Society with me, Sarima, and I'm joined with two very knowledgeable people in the line of CPR. We were talking earlier on the show on how we need this basic training as a nation because Dr. Abdullah, who's with me from Damansara
Ramses, I'm W. Ara Damansara Medical Centre.
You yourself are starting a new program at your hospital where you're assisting people in training in basic CPR, because you said the time frame to get to someone who's had a stroke, you need to get to them within 4 to 6 minutes so that they don't suffer permanent damage. And also in terms of cardiac arrest, sudden cardiac arrest, what is the time frame there to save the person's life, say?
Sudden cardiac arrest, you should get to CPR as quickly as possible. You should not waste even a second.
And unfortunately, sometimes the ambulances with our traffic in Malaysia and our terrible drivers who don't want to move, you know, it takes longer than that. Datin Liu is with me. You yourself, you know, you have dealt and you've carried out so much CPR in your lifetime yourself. And as Dr. Abdullah demonstrates to us, I would like you to answer some questions. So say a person's fallen to the ground. This is the scenario. Okay. If it's a guy or a girl, does it make a difference, Datin?
No, it shouldn't. You know, it's an adult. As a child, there might be a difference according to the pressure that you put amount of pressure, but a male or female should not have any difference.
Okay, so Dr. Abdul, what's the first thing you do? The person's lying unconscious.
First thing, go down.
Okay.
And tap on his shoulder and say, "Hello, are you okay?"
Okay.
That's the first step. And if I don't get any response from him, then I call for help.
Right. Say there's no help. You're home alone.
If there's no help. As a medical professional, I would want to check his pulse.
Okay.
But for people who are non-medical, I would say do not check for the pulse. You go for CPR straight.
So, Datin, just quickly in there, how do you know the person's needs CPR and they just didn't like have low blood pressure or have a food allergy?
I think you have to actually check the pulse for that, you know, look at the carotids, you know, the carotid.
But we don't know that.
Yeah, or the pulse, you know, and you have to well, listen to the heartbeat if possible.
Okay.
But if no response, then you assume there's a cardiac arrest.
A cardiac arrest. So what's the first step in the cardiac arrest, Dr. Abdullah?
Your first hand or your dominating hand, you're going to use heel of your hand. Okay, and this goes down onto the center of the chest on a flat bone that is called sternum.
Yes.
And then your second hand goes on top of this hand and you intertwine your fingers and you get on top of the body.
Put all your weight on top.
All your weight, you see my elbows are locked.
Yes.
And my shoulders are on top of the body.
Yes.
You have to be on top of the body so that you can give full force and you go down like this.
How many times?
100 per minute.
Really fast? With full pressure?
Full pressure, 100 per minute.
This is how you do it?
This is exactly how you do it.
100 per
100
minute?
per minute. The only thing I want to show, don't do like this. Because when you do like this, you're going to get tired very fast.
Don't lean back.
Do not lean because you'll be using so many muscles.
So lean how? Forward?
On top of the body. On top of the body. Like this. So that you can use your shoulder power.
And go fast?
Go fast, at least 100 per minute.
And if the person's not responding still after you do this?
Continue doing it until help comes.
Okay.
This is called hands-only CPR.
Okay. The next option would be also you have the mouth CPR.
Mouth CPR, nowadays a lot of people don't want to do that because they don't know whether victim is having AIDS or victim is having hepatitis.
I see.
So if you do not want to do that, still okay, but do not stop your compression.
So keep going, doctor, is what you're saying. Unfortunately, we don't have more time than that. At least we got a short demonstration, Datin, on, you know, how to carry out CPR in the basic way for someone who's just collapsed and hasn't responded to you. Take the safer route, as you mentioned, Datin, instead of, you know, checking the pulse, etc., get straight in there. But I would assume you have to call for help first, pick up the phone, 999, and then do this particular procedure. So keep pumping, keep your body weight forward. Thank you very much, Dr. Abdullah, and also to Datin Liu. We do hope that more Malaysians out there will take the time. There are places available. Where can they go to check out this course online?
Online, they can go to IGN, they can come to our hospital.
To learn how to do this?
To learn how to do it, you can just come to emergency department and we can take care from there.
Okay, well, thank you for that. This is very important in life because you never know when you yourself might need it or your loved one might need it. I'm going to have to learn how to do this. Next up in Bella Society, we're going to be talking about different things that are happening on the show tomorrow. That's after this.
Thank you so much.
Thanks.
Can I just add that in the Heart Foundation, we also conduct courses in CPR. So you can go online for that. And our website is www.jygm.
Thank you very much, Datin. And with that kind of information, actually, we've actually just gone straight into the end of the show. at least we got some time to do some basic CPR. Tomorrow on the show, you'll be with Belinda. She's going to be talking about perfume pairing, which is completely different to what we talked about today. I need to learn how to do this. Go check out a repeat of the show on tonton.com.my and also follow us on Instagram and like us on Facebook. And I'll be back again on Friday for a different type of show. I need to get straight into this because this is concerning me. We don't know enough about CPR. So see you again on Friday. Bye.
Thank you.